Hello there and welcome to the channel. This video is going to be a summary of everything I've learned over the last 25 years about self-help treatments for osteoarthritic hand pain. Osteoarthritis is the most common degenerative joint condition that we see, and if you want to know more about the specifics of this condition, then I've done a separate video all about osteoarthritis which you can check out up here. And amongst all the joints commonly affected by osteoarthritis, the thumb-based joints are right up there with the hips and knees. And so I've also done a separate video to specifically address thumb osteoarthritis, which you can also check out here. Or you can see a link for both of these videos in the description below. Today's video, though, is aimed at those people with osteoarthritis affecting the small joints of the hands and fingers, what generally gets referred to as nodal arthritis, because people with the condition often get bony thickenings or nodes over the finger joints. These arthritic thickenings are not soft tissue swellings, ganglions or other cysts, which can also be seen commonly around the wrists and fingers. These thickenings are firm and bony in nature, as we can see on this X-ray of a typical osteoarthritic hand. The thickenings over the very end joints are called Heberden's nodes, and the thickenings over the middle finger joints are called Bouchard's nodes. You can also have bony thickenings over the knuckle joints, but these are less common. Now, it's important to note that this video assumes that you've already been diagnosed with nodal hand osteoarthritis. If you haven't, and you have symptoms of hand and finger pain and stiffness, then please get checked out first, because there are other conditions that can cause similar symptoms, and often a simple blood test along with an X-ray will help to confirm the diagnosis. Okay, so with that done, let's get cracking with some of the best self-help treatments that I've found over the years to help with nodal hand arthritis. First up are the various wraps and splints. If you've got one or two affected fingers, then you could try a simple elasticated finger splint. A single finger sleeve or a pair of mouse's trousers can help support the finger joints in a comfortable position, and that can help with arthritic finger joints which might have flared up and become swollen and painful. Used alongside anti-inflammatory tablets or rubbing gel can often calm down a flared up finger joint. Just make sure that you check with a pharmacist first before using anti-inflammatories, as not everyone can take them. An alternative to the splints is an elasticated wrap such as this, which is called Coban. It comes in different sizes, but the 2.5 centimeter width is perfect for finger joints. Just cut a length of about 10 centimeters and then carefully wrap it around the finger joint while applying a little bit of stretch. Not too tight though. If your fingertip turns wide, then start again, but less tightly. It sticks to itself, and at the end of the day you can take it off and reapply the same strip the next day. You can even wash it, so a roll like this can last for many months. It's a really versatile product that you can use in different lengths and using different amounts of tension to suit your individual finger, and provide just enough support to be effective while still allowing a good amount of finger movement. It also helps cushion against those irritating knocks and bangs that can occur all too commonly when you've got a painful finger joint. Now, if you've got hands where most of your finger joints are arthritic, then it might be too much trouble to use splints or apply Coban to every single joint. In this case, I would suggest using a paddle splint at night and when resting during the day. Something like this will support all of the finger joints in a comfortable position while you're inactive. This particular one is flexible, and the position of each finger can be adjusted to suit you. I'll put a link in the description below for all these splints and also the Coban wrap. Another thing worth trying if you have multiple finger joints affected is the use of therapeutic heat. Now, you could use a hot pack wrapped around your hands or a heat lamp, but I can suggest a better way. When I first qualified many years ago, we used to use a wax bath to help people with hand arthritis. This was a large vat of paraffin wax which was warmed up until the wax melted. You put your hands in the molten wax and it would set as soon as you took them out and form a warm skin of wax around your hands, which would mould into all the nooks and crannies of your finger joints. After about 20 minutes, you peeled off the wax and put it back in the vat where it melted again, ready for the next wax bath session. You then spent another 20 minutes or so doing some gentle exercises with your nice warm joints. This treatment was repeated weekly, sometimes for many months, and whilst it certainly didn't cure the condition, it did provide some therapeutic pain relief, which patients found very helpful. Now, for various reasons, not least infection control and cost, wax baths fell out of use in most therapy departments a long time ago, but you can still buy small modern versions which are just big enough for personal use. They come with everything you need to treat a pair of arthritic hands or feet. When I looked recently, they were under £80 or $100 online as I record this in 2022. Again, I'll put a link in the description to a wax bath that I can recommend. If you want to try a cheaper Heath Robinson alternative to a wax bath, then I found that a similar effect can be gained by rubbing olive oil into your hands and then putting on a pair of rubber gloves or surgical type gloves. Then place your hands in a bowl of warm water for 20 minutes. It's a bit more messy than paraffin wax, but the effect is similar. Now, we've spoken about exercises for hand arthritis, and this can definitely be a helpful treatment if you do them regularly. I'm going to do a separate video demonstrating a hand exercise program, which I'll link to up here when it's done. But the essence of a therapeutic hand exercise program are about function rather than strength. Just squeezing a ball or grip springs will most likely just irritate your hands. Instead, look for activities which focus on dexterity and function, such as moulding plasticine or therapeutic putty into different shapes, tying and untying knots in a shoelace, picking up grains of rice or dried peas, shuffling and turning over playing cards, fastening and unfastening buttons, etc. Alternate different fingers with your thumbs, don't just use your index fingers all the time. Playing with a Rubik's Cube can help move your wrist and fingers into all different directions, and it's fun too. Put all these bits and bobs on a lap tray and fiddle with the various bits and pieces while watching TV. It's a great way to help maximise your hand function. It's also worth noting that if you have a hobby like knitting or craft work that's aggravating your hands, then it's probably because you're doing that particular repetitive movement for too long. You're going to need to reduce the time spent doing that hobby and instead use the time to vary your hand movements by doing some of the other activities and exercises that we've just talked about. A lot of people with hand arthritis will also have problems with everyday tasks such as holding a pen, turning a key in a door, opening jars and cans, or even holding a knife and fork. Well, there are lots of different aids and adaptations available now which can make these tasks much easier. There are rubber grips that can slide over pens and keys to help make gripping them easier. There are thickened and angled cutlery handles, tools that make opening cans and jars much easier, and there's even a gizmo that helps you fasten buttons and pull zips, and new products seem to be springing up almost every week online. And many of these things can make a huge difference to those everyday tasks that people with hand arthritis can really struggle with. Most of them are inexpensive, and I'll put a link in the description below which points to some of the most useful ones that I've found. So to summarise, in my experience, these simple treatments that we've discussed can make a real difference to the daily pains and stiffness of hand and finger arthritis, but they do need to be done regularly, as they aren't going to cure your condition. The aim is to provide some therapeutic relief from the symptoms of pain and stiffness. Now, if your symptoms continue to trouble you despite trying these things, then do go and see a hand therapist or an MSK hand specialist. Specific splints or exercises tailored to your hands might be needed, or perhaps a cortisone injection into a particularly painful joint. Sometimes surgical treatment, including joint fusion or joint replacement, may be needed, and so you might need to see a hand surgeon. Okay, well that about wraps things up. I hope you found the video helpful. Thanks very much for watching, and bye for now.